And joining us now is Dr. Richard Besser, former acting director of the CDC. He's now president and CEO of the Robert Wood Johnson Foundation. Dr. Besser, good morning. These guidelines are going to give a lot of people relief. For one thing, they say if you're vaccinated, you can hang out with other vaccinated people. And if you're vaccinated, you can see family members as long as they don't have an underlying severe risk of COVID. What did you make of these guidelines?
I'm excited about these guidelines. I think it gives us a cautious step forward and an emotional release in the sense that we really truly are on the road out of this pandemic. You know, for elderly people who may be socially isolated, now they know that if they're fully vaccinated, they can get together with friends who are fully vaccinated. They can hug their grandchildren. Now, my parents are both in their early 90s, and I know for them, getting those 2 doses of vaccine, being fully vaccinated, and now knowing they can get together with other people, that's a huge, huge emotional release and lift.
Now, you mentioned the word cautious with regard to these guidelines, and a lot of experts have said that. For instance, it's still warning folks not to do unnecessary travel. I think it leaves open the question about restaurants and bars. So let's say you want to see your grandkids, but they live in another state. What are you supposed to do?
Well, according to these guidelines, you should still hold off on that. And I expect that it's not going to be long before CDC revises their travel guidelines, revises their guidelines for other indoor spaces if you're fully vaccinated. I think one of the concerns is that still across the nation, the percentage of people who are fully vaccinated is very low. And we're seeing a lot of states remove restrictions that really need to stay in place. The idea that states are telling people that they don't need to wear a mask, that there's no mandate for wearing masks at a time when the situation is still very tenuous, that's very concerning. So you have competing guidance that's based on public health science that CDC is carefully putting out, and then a lot of states that are opening the door to activities that truly isn't safe.
Yeah, you know, on the guidelines, I mean, the linchpin here seems to be the open question. We don't know yet if you're vaccinated, if you can still transmit the virus. We know the vaccination will keep you from getting sick. It'll keep you from going to the hospital. We don't know if a vaccinated person can transmit COVID to somebody else. Are we any closer to getting an answer to that?
We are much closer to getting an answer. So in addition to the guidelines that were put out yesterday, the CDC put out a science review. And in that science review, they review the evidence on that specific question. And what they say is that there are animal studies that show that vaccination reduces the amount of virus in your nose, reduces the ability to transmit. And there's real world studies as well that show that some of these vaccines reduce the ability to cause asymptomatic infection or any infection at all. One of the outstanding questions, though, has to do with some of these variants that are out there and whether the vaccines will be as effective for that. And I expect that that's probably what's holding CDC back from guidance and changes here that are less cautious than what we heard yesterday.
All right, Dr. Besser, thank you very much. But the headline is good news for grandma and grandpa, and they want to hug those grandkids.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.